I'd like to welcome the group to the Multimodality Transitions of Care demo featuring the ONC-sponsored, IHE-approved 360X protocol. The primary goals of 360X are to enhance communication across care transitions, improving the quality and efficiency of care, decreasing provider and staff workload, documentation burden, reducing or eliminating transcription errors, and decreasing costs by eliminating unnecessary and inconvenient duplicate testing. We hope that as you watch this demo today, you'll see these goals realized. Our patient is Donnie Boyd. He's a 75-year-old morbidly obese man with a history of multiple medical problems, including type 2 diabetes, COPD, hypertension, and hyperlipidemia. He's also a current long-term heavy smoker. Unfortunately, he had resisted all efforts to convince him to get COVID-19 vaccination and unfortunately came down with the disease, was hospitalized, had to be intubated, and had a long intensive care unit stay. Prior to this hospitalization, he had been living alone independently, but he did have weekly home health visits to help manage his multiple medical conditions. In the hospital, he's been successfully weaned off the ventilator now and is ready to be discharged. The hospital has arranged for home health services to be biweekly for shower and laundry assistance due to his functional limitations. At the time of his discharge to home from hospital, per the condition of participation ADT alerting, the hospital, using the Bamboo Health COP route solution, sends discharge notifications and a summary CCDA over the MedAllies HIMSS to the patient's PCP and to the home health agency where he was receiving home care services prior to his COVID-19 related hospitalization. On receiving the alert, the PCP practice, per their protocol, schedules the patient for a follow-up appointment within 48 hours of discharge and reconciles the discrete data that they received from the hospital CCDA. The home health agency, using MatrixCare, puts the patient back on the home health visit schedule and reconciles the patient's chart. Let's see this demonstrated, starting with the Bamboo system. Over to you, Corinne.
Hi, my name is Corinne Pellos, and I'm from Bamboo Health, and I'll be talking through how Donnie's discharge is automatically sent to his care team. To start, Hillsborough Bay Hospital sends an ADT message to Bamboo Health that includes the providers who should be notified. From there, Bamboo Health looks up those providers' direct addresses using MedAllies directory. We can then send a direct message in real time to Donnie's care team, which includes Dr. Peter Massoud, his primary care physician, and Safety Harbor Home Health, his home health agency. These direct messages can be integrated into these providers' tools and workflows. To show you how that works, I'm going to hand it over to Ryan from MatrixCare.
All right, thanks, Corinne. So Ryan Stutzman with MatrixCare, representing the home health agency today. So you can see that Donnie Boyd's referral and discharge notification has arrived in my inbox. If I move over to the other page, you can see that the CCDA that was contained in that message has been broken apart into a human readable section, a summary, as well as the discrete data elements. So I can reconcile patient demographics, any additional documents that were attached to the referral, contacts, diagnoses, allergies, and medications. In this scenario, I'm going to open up the diagnosis section, and you'll notice this was an existing patient record, so I have some other diagnoses on his record, but the one addition is the COVID diagnosis, so I'll go ahead and add that to his record by selecting a type and an onset for the date. And then I'll add the selected diagnosis, putting that new COVID diagnosis into his chart. Other than that, I will schedule those biweekly visits for Donnie, and his care will progress at the home health facility. And with that, I will hand it back to Dr. Miller.
Thank you, Ryan. At Donnie's follow-up visit with his primary care physician, Dr. Massoud, which happens only a day after his discharge, he complains of a severe itchy rash, terrible headaches, and intolerable anxiety and depression. He's really afraid he's going to die, as well as fatigue and diminished capacity. Dr. Massoud examines Donnie, photographs the rash, and administers a PHQ-9 test, which does demonstrate significant depression. Together, Dr. Masood and Donnie agree he should have 2 visits from home care per week, but also he and Donnie agree that he needs to see multiple specialists, a dermatologist for the rash, psychiatrist for the depression, and a neurologist for the headache. His PCP orders these referrals. Over to you, Azim, to see these referrals being ordered in the ECW system.
Thank you, Dr. Miller. My name is Azim Mohammed from eClinicalWorks, and I'm playing Dr. Masood. Donnie's in for his appointment. We've gone ahead and captured his headaches, chief complaint, his current medications, and his vitals for today's visit. Along with that, I've recorded his assessments, one being the rash, type 2 diabetes, his headaches, pulmonary disease, and COVID-19. As mentioned, I've also created 3 referrals for Donnie to be seen by specialists. In the dermatology referral, I've included my reason, the diagnosis, and attached 2 items, a CCD and the image of the rash to be sent. Upon clicking the send button on this referral, the system generates a unique 360X ID to be sent across the 360X protocol. In the psychiatry referral, again, I've included my reason and my diagnosis. I've included the CCD and the PHQ-9 that I did with Donnie. I'm going to send that over to the specialist as well. And for the neurology, I'm only including the CCD, and I've already triggered that to be sent to the neurologist. Back to you, Dr. Miller.
Thank you, Azim. So starting with the dermatology referral, Dr. Anderson's office staff received the referral request. They review his availability and find they can accept the request, which they then send back that 360X accept notification to the ECW system, to Dr. Masood's office. Donnie has the encounter with the dermatologist, who reviews the chart, opens the PDF of the rash to be able to compare it to what the patient is experiencing that day, and then recognizes that the dermatologist wants to do a punch biopsy to confirm the diagnosis. The Nextgen dermatologist sends a patient cost transparency request to the payer via the Mettle system and receives back through the Mettle system the advanced explanation of benefits, which you will see demonstrated in the Nextgen and Mettle system. The Nextgen dermatologist then has the consultation with the patient, perform the punch biopsy, which is negative, and so by exclusion of other diagnoses, they attribute the rash to COVID-19 as known side effect of COVID-19. There are rashes. So at this point, the dermatologist concludes the consultation and sends that back to the primary care physician, where this receipt closes the referral loop and Dr. Masood reconciles the new information in his chart. Let's see this now demonstrated in the Nextgen and in the Mettle system.
Thank you, Dr. Miller. Hi, everyone. My name is Dmitry Shalomov. I'm with Nextgen Healthcare. So in this demo, we are playing role of dermatology practice, and we received referral request from Dr. Masood, which is shown here, and we already sent acceptance. So acceptance received by PCP, and it shows that we're going to take care of patients. So now patient comes to the office, and we are basically dealing with persistent rash. That is the reason for the referral. With this request, we received consolidated CDA that has all the data relevant to the patient. So we have medications, allergies, problems, immunizations, results, encounters, etc. And we are able to discretely import all the data from this document into the patient's chart. Apart from that, we also received a picture of the rash, so we're able to review the rash and review the picture and compare it with current state of the affected area of the skin. And we decided that we need to do punch biopsy. So for that, we're going to use Smart on Fire application provided by Mettle Solutions. So I'm going to launch this application right from our EHR. I'm going to allow access to given file resources that are necessary by the Smart on Fire application, and I'm going to transfer to Melanie from Mettle Solutions so she can guide us through the Smart on Fire application.
Thank you, Dimitri. Good afternoon. I'm Melanie Combs-Dyer from Mettle Solutions, the developer of the PayX Smart on Fire app. To help providers comply with the No Surprises Act, Metals has incorporated the Da Vinci patient cost transparency rules from Da Vinci into the PayX app. So let's see the Mettle magic that Dr. Anderson sees in the EHR real time while he's face-to-face with Mr. Boyd. Dr. Anderson clicks on that button called Request Pricing and selects Mettle as the payer and Punch Biopsy as the service. Dr. Anderson clicks the Submit button and a good faith estimate is submitted to the payer. The payer's system processes this estimate and instantaneously sends back an advanced explanation of benefits, or an AEOB. When Dr. Anderson clicks on the Check Status button, he can view the AEOB and see what amounts Donnie is responsible for. So Dr. Anderson and Donnie have a conversation about the cost, and Donnie decides to proceed with the biopsy. Back to you, Dimitri.
Thank you so much, Melanie. So as we see, we able to provide the explanation of benefits right during the encounter with the patient. So patient doesn't have to wait any time, and it's completely transparent what would be the cost of procedure, what would insurance cover versus what would be out-of-pocket cost. So with this, we able to perform this punch biopsy, and like Dr. Miller said, we're going to detect that the rash is related to COVID, and we're going to prescribe Kenalog topical aerosol cream to apply to affected area of the skin. And with that, we're going to be able to enter all this information into patient's chart and close this loop by hitting update button, and this will generate new consolidated CDA. It will attach it to the same referral ID that's been generated by PCP and send it back to PCP. So this would close the loop for this particular encounter with dermatologist. Back to you, Dr. Miller.
Thank you, Dimitri. So you'll recall that the second referral was to the psychiatrist. Dr. Jones' office staff received the referral request. They review her availability and accept the request. They create a new patient chart, as this patient has not been seen in their practice before, and they ingest the discrete data from the CCDA into their EHR system. In addition, they are able to store the PHQ-9 in their system as well. Dr. Jones has the encounter with Donnie and determines that he has severe depression with anxiety. She starts him on an antidepressant with anti-anxiety features. She then receives and documents consent from Donnie to share her psychiatry encounter information with Dr. Masood, the PCP, and sends the consult back to the PCP on ECW over the MedAllies and ECW HIMSS. Question to the audience: why does Dr. Jones need consent and Dr. Anderson did not? Exactly, because this is a psychiatry encounter. So it's a psychiatry encounter is going to be the only reason that in this kind of workflow of referrals you would need to have consent. But Netsmart is able to document that beautifully, and so they then send that consult CCDA back to the PCP, who then closes the referral loop, and he's able to reconcile the information in his chart. Let's see this demoed by Lindsay in the Netsmart system. Over to you, Lindsay.
Good afternoon, everyone. My name is Lindsay Lightfoot with Netsmart Technologies. Today I am playing the role of a referral coordinator in the office of Candace Jones at Netsmart Practice. As you can see in our system, we have received a referral for Donnie Boyd from Donnie's PCP, Dr. Peter Masood. In reviewing this referral, I'm able to look at his CCD, noting his current allergies, care team, encounters, immunizations, medications, etc. that pulled into his CCD, as well as quickly review his PHQ-9. From there, I'm able to check our schedule and determine we have availability to accept this referral. So I'll choose referral. I'll choose to accept under referral action. If Dr. Jones was not able to receive Donnie for care, I would reject this referral and the system would send an automatic 360X rejection message back to Donnie's PCP. As part of the acceptance workflow, I'm able to search for Donnie, or search for a client rather, in the client search, and determine if Donnie has been to our facility and received care before. See below how Donnie's name populates. For the purposes of today's demo, we are treating Donnie as if he's never been to our facility and received care before, and admitting him as a new client directly into our EHR. From here, we can choose where in the chart to save the attachments that came with the referral. The system will automatically launch the admission form and pull discrete data from his CCD directly into his chart. Information such as his demographics as well as his address. Additionally, PAMI data is also pulled in. This prevents rekeying for the end user and duplicate entry and shows value of interoperability in the real world. From here, the system sends an automatic 360X acceptance message back to Donnie's PCP, Dr. Peter Massoud. But I have the option to let Dr. Massoud know that my next steps are to call the client and schedule his first visit. Jumping into the future, today is Donnie's first visit with Dr. Jones. As part of his first visit, Dr. Jones reviews his PHQ-9. She notes his responses regarding the severity of his anxiety and depression. She also performs a clinical evaluation and reconciles the problems and allergies in his chart, deciding which of those problems and allergies to pull into his chart. Lastly, she completes an ambulatory progress note with details from Donnie's visit, noting that she'd like to start him on Lexapro at 10 milligrams, given the answers to his PHQ-9. Upon finalizing this note and submitting this back to Donnie's PCP, the system will send an automatic 360X referral complete message, thereby closing the referral loop. Over to you, Dr. Miller.
Thank you, Lindsay. You'll recall that the third referral was to Dr. Allen, a neurologist for Donnie's headaches. Dr. Allen's office staff received the referral request. They review her availability, and once again, they're able to accept this referral. And I'd like to call attention to the fact that although we won't be demoing fire scheduling today, Argonaut fire scheduling dovetails beautifully with the 360X protocol. With this real-time scheduling, Donnie can leave the office with his referral appointment in hand, which we think will dramatically help lack of follow-up with referrals and no-shows. I think we should also mention that the 360X process in and of itself has reduced what would normally be months of time finding appointments, scheduling the appointments with these specialists to the time frame of 1 week in our demonstration. Donnie has his visit with Dr. Allen, who determines that Donnie needs to have a brain CT. She thinks it might be long COVID, the headache that are causing the headaches, but with his past medical history, she really doesn't want to rule out something else like mini infarcts or a brain bleed or anything else that might be going on. At the time of ordering, the neurologist is alerted that the CT will require prior authorization, so you will see now Epic and Mettle's demoing the prior authorization using Smart on Fire. Ultimately, the prior authorization is completed and the patient has the brain CT, which is negative. The neurologist attributes the headaches to long COVID syndrome and sends the consult CCDA back to the ECW PCP. That being said, this closes the referral loop. But in addition to the neurologist's finding regarding the headaches and long COVID, she found that his ICU stay of 1 week has him so debilitated and decompensated physically that he really cannot be functioning alone, even with 2 home health visits per week in his own home. So she recommends that he have a brief admission for rehabilitation to a skilled nursing facility. Let's see this now demoed in the Epic system and the Mettle system. Over to you, Dakota.
Thank you, Dr. Miller. Hello, everyone. My name is Dakota Leonard. I'm a software developer on the caregiver team at Epic, and today I'll be playing the role of a couple of people at University Neurologist, starting off as some front desk staff. I'm here in Epic, and I can see Donnie Boyd's referral. I can see that Dr. Masood requested he see Dr. Allen about some headaches. All this is pre-populated thanks to the 360X process. And if I need additional medical details, I can dig into the CCD I also received and see Donnie's medical history. All this being pre-populated has massively sped up my workflow for deciding whether or not we can take on Donnie, and knowing all this information and Dr. Allen's schedule, I can go ahead and accept this referral. That way Dr. Masood, the PCP, knows that we will indeed be able to see Donnie for his headaches. So I'm going to go ahead and accept that. And then from there, we could get Donnie scheduled again in the future using FHIR, or for now with a phone call, or pushing him out a request through the MyChart patient portal so he can schedule himself if he wants to. Now we're going to get in my time machine, go to the future, and now I'm playing the role of Dr. Allen, the neurologist. At this point, Donnie's in front of me, we're in the office, and we've been discussing his symptoms. Again, thanks to that CCD, much of the documentation was already done for me as if we had seen him in the past, even though he's a new patient, which means I can spend more time talking to Donnie and less time on my keyboard. After talking with him, it seems likely that COVID has caused his headaches, but I want to be for sure, again, because he has so many past medical issues. So I'm going to go ahead and order a CT scan to kind of make sure that nothing else is going on here. Now, as I do that, we've been looking into the best way to utilize Da Vinci specifications for looking into coverage and prior auth requirements from payers automatically right in the provider's workflow. So when I do this, a little prototype we have is going to launch the PayX app right in Epic, and we'll be able to do some of this documentation up front. And I'll pass this off to Melanie from Mettle Solutions to show us what that's like.
Thank you, Dakota. Melanie again from Mettle Solutions, the developer of the PayX Smart on Fire app. I'm going to show you the Mettle magic that Dr. Allen sees real time in the EHR while she's face-to-face with the patient. Dr. Allen knows how important it is to document the right things in the medical record so that Donnie's payer can approve the prior authorization request the first time it's submitted without much backing and forthing and requesting more documentation. When Dr. Allen signs the order for the CT scan, the PayX app, following the Da Vinci, CRD, and DTR implementation guide instructions, checks the coverage requirements of Donnie's payer for brain CT. In just a second, you'll be able to see the PayX app pulling the list of data elements Donnie's payer requires for brain CT. PayX searches through all the past EHR entries, this is the cool part, and pre-populates the template as needed. So Dr. Allen doesn't have to retype all that information. If Dr. Allen wants to see the pre-populated data, she can click on the pre-fill button. Back to you, Dakota.
Thanks, Melanie. Now, with all this information pre-populated for now, and for the sake of the demo, I'm just going to close this out. It's all saved, and my backroom staff can complete any additional documentation we need. Luckily, we're able to get Donnie a same-day CT scan, a miracle in this world, and we're able to see the results. And I can see there's no radiological reason that Donnie might be experiencing his headaches, so I attribute this to long-term COVID. So what I'm going to do is go ahead and write a letter back to Dr. Masood with that finding. He's also going to get a CCD of all the documentation I've done today. And additionally, after talking to Donnie, with all of his debilitating symptoms, I don't think 2 home health visits a week is enough for him. I really think admission to a skilled nursing facility is required. So I'm going to go ahead and put that in my letter as well. So we'll address this to Dr. Masood. Go ahead and pull in my completed letter. I can give that a quick glance over. It's got everything in there. Send him to a sniff, please. And then I'm going to go ahead and send this back to Dr. Masood, the PCP. And we can see what that looks like in the ECW system. So I'll hand us over to Azim.
Thank you, Dakota. So anytime a patient record is received into ECW, ECW automatically matches that information to the patient's chart and downloads it into their record. It also assigns it to the provider. I'm going to demo this from a progress note. So if Donnie, for example, let's say came in for a visit today, as a provider, I can access that detail by clicking on the DRTLA tab. And right here, I can scroll down to my documents and my ECW PDP patient records area. From the neurologist, I can see here that they sent over his progress note. So now I can review that while Donnie's here in the office today. I can also take a look at the CCD that was sent over for Donnie as well. Now, I do have the PDF version here, but it's also sent as an electronic form, which allows me to open it up and view his problem list from the visit, allergies, medications, and his histories. As a PCP, I can also import any one of these items using this blue arrow icon, so that way I can discuss with Donnie today. Back to you, Dr. Miller.
So, as we mentioned, Donnie's primary care physician is convinced by the neurology consultation that Donnie really should be admitted to a skilled nursing facility. In the real world, often this requires sending a request to more than one skilled nursing facility because one may be full, another one may not be. So often a hospital or anyone referring to a skilled nursing facility will make multiple requests at the same time. 360X accommodates this as Dr. Masood's office is able to send the request to two different skilled nursing facilities. The skilled nursing facilities receive the requests along with the patient review instrument, which is required for authorization to a skilled nursing facility, and both are able to accept the patient, so both respond that they accept the transfer. At that point, Dr. Masood reviews with Donnie the skilled nursing facility performance data. Donnie selects the Netsmart skilled nursing facility, Palm River Healthcare Services. So the primary care physician sends to that skilled nursing facility a confirm accept patient transfer, so they know that they will be receiving that patient. To let Good Health Center know that they will not be having the transfer, they send a discontinue patient request, so they know the patient is no longer going to come to their facility. Donnie is admitted the same day at his selected skilled nursing facility, where he will receive the daily care, rehabilitation, and attention he requires to be able to become in good enough shape to make it alone at home. At patient admission, the skilled nursing facility creates a new patient chart from the CCDA received from Dr. Masood. Bamboo Health, acting for the skilled nursing facility, sends ADT skilled nursing facility admit notifications to both the primary care physician as well as to the MatrixCare home health system where Donnie had previously been being seen. MatrixCare receives the admit notification and removes Donnie from the home health schedule. Let's see this all demonstrated, starting with ECW.
Thank you, Dr. Miller. So speaking with Donnie, we've gone ahead and created two referrals to go to two skilled nursing facilities. The first referral here will go to Good Health Center. I've included the reason, a diagnosis, and I'm attaching a CCD, as well as Donnie's PRI. Now, as I click that send button, the system does generate a unique 360X ID to be sent over the 360X protocol. And for the second facility, Netsmart practice, again, I've included my reason, diagnosis, and attached the CCD as well as Donnie's PRI to send that across over to them. Now I'm going to hand it over to Alex at Node 2 to demo the skilled nursing process.
Thank you, Azim. Hi, everyone. My name is Alex Kern, and I'm from Node 2. Today, I will be playing a referral coordinator at Good Health Center. Node 2 is going to help Good Health Center manage these referrals because they either don't have an EMR or they have an EMR that's an integrated partner of Node 2. So we're going to jump into the My Intake inbox in Node 2, and we will see the 360X referral for Donnie come over from eClinicalWorks. When we go into the referral, we can preview the referral in the window here and see all of Donnie's information. In the tab to the right, we can use the CDA Explorer to drill down specific sections, such as medications, encounters, etc. And if we want to rearrange these sections based on what's most important to the referral coordinator, you can move around and drag and drop the sections. In the top right corner, we'll be able to accept or decline this referral. And in this scenario, the PCP and Donnie are going to select the other skilled nursing facility. So we'll see that cancellation notification come through as well in Node 2. Now over to Lindsay.
Thank you, Alex. Hello, everyone. Again, this is Lindsay Lightfoot with Netsmart Technologies. And I've received a referral for Donnie Boyd from Dr. Peter Massoud. In reviewing this referral, I'm able to look at the clinical documentation that came with it, including Donnie's CCD. Scrolling through, we're able to see his current allergies, encounters, functional status, immunizations, medications, etc., as well as his PRI document. I know at Palm River Healthcare Services, we have the availability to accept this referral. If we did not have availability to accept this referral, I would reject this referral here under referral action. And that prompts the system to send a 360X rejection message back to Donnie's PCP. As part of this acceptance workflow, I will now search for the client in Client Search by inputting his first and last name to determine if Donnie has been to our facility and received care before. See below how Donnie's name populates. For the purposes of today's demo, we're treating Donnie as a new client and admitting him directly into our EHR. Then we'll choose where in the chart to save the clinical attachments. The system will automatically launch his admission form and pull in discrete CCD data into his chart. Information such as his first and last name, gender, date of birth, demographics such as his address, as well as PAMI data, problems, allergies, medications, immunizations, etc., will also flow in. Allowing this information to flow directly into his chart shows the value of interoperability in the real world. From here, the system will send an automatic 360X acceptance message back to Dr. Peter Massoud. But I have the ability to add an additional message, such as letting his PCP know that I will call the client, Donnie Boyd, and schedule his admission. Over to you, eClinicalWorks.
Thank you, Lindsay. So speaking with Donnie today, we've decided that he does not want to go to the Good Health Center nursing skill facility. So right within the product, we're going to send a discontinue message over to Node 2 so they are informed of that. And for Netsmart Practice, I'm going to go ahead and click in there. I'm going to send a acceptance or confirmation so that they're aware that Donnie will be seen at this location. Now, to show the acceptance, I'm going to hand it over to Corinne for Bamboo Health.
Thanks. Hi, my name is Corinne. I'm from Bamboo Health. I will be acting as a home health coordinator. Here you can see that I've received an email notification letting me know that one of my patients has been admitted to Palm River Healthcare Services and has some diagnoses associated with COVID-19. From here, I can click on either of these links to be brought into the Bamboo Health platform, where I'll be able to see that Donnie was admitted, and he was admitted because of a need for assistance with personal care. To find out more about Donnie's demographics, care team, or encounter history, I can click on his name, and I'll be brought into his patient profile. Here you can see additional demographics. I can tell that Dr. Peter Massoud is his primary care physician. And if I keep scrolling down, I can see both his active and his previous encounters. The active encounters are identified by this yellow bar, so I can tell that I'm currently taking care of Donnie, but he is also being taken care of at Palm River Healthcare Services. If I wanted to know when his need for services escalated or where it kind of started from, I can see here that he was originally at Hillsborough Bay Hospital for a long COVID stay, and that event may have triggered these additional need for services. From here, I'm going to want to go into my system and discharge Donnie so that I don't end up going to his home when he's not there. To tell you more about that, I'm going to hand it over to Ryan from MatrixCare.
Thanks, Corinne. So back at the home health facility, the intake team receives the admit notification for Donnie Boyd, and they know right away that they need to get him off of the schedule. So to do that, I'm going to go ahead and change the admission status to transferred on hold with a reason of transferred to skilled nursing facility. Now, once I click the save button, two important things happen. One, Donnie is immediately removed from the schedule, which prevents the home health aides from showing up at his house when he's not there. And then two, we send back a CCDA document to his primary care provider that contains any additional health information that he received while under the care of the home health aides. And with that, I will hand it back to Dr. Miller.
Thank you, everyone. So, in summary, I hope you've seen that pushed essential information in real time during care transitions decreases provider burden and cost, enhances the quality and certainly the efficiency of care, as well as patient, caregiver, provider, and staff satisfaction. Referral management has long been a time-consuming and frustrating process. There are several products that people sell to manage referral management. 360X in and of itself is not a product, it is a protocol, an IHE-approved protocol. 360X allows for transparency of the progress of transitions of care throughout the entire process, be they transfers, as you saw, or referrals. We'd really like to give special thanks to Brett Andreessen. He's been the leader from ONC for many, many years of the 360X project. In addition, we'd like to thank the standard development organizations that you see listed, whose standards we demonstrated throughout this experience today. Finally, this ends our demonstration, but we'd like to invite you to stay and ask questions. We have white papers about 360X if you have further interest in that protocol. And in addition, you can scan your badge. Someone will get back to you with more information about 360X. Or if you don't want to carry paper with you, the white papers have a QR code which you can download and have the information at home. So thank you for watching, and please ask any questions you might have.